Hi, my name is Dr. Corey Richardson. I'm the ICGH CEO and Clinical Director, where we focus on recovery, lifelong recovery, and not just treatment. We're going to talk a little bit today about our healthcare services across North Carolina. At ICGH Treatment Centers, our mission is to provide accessible and comprehensive behavioral health services to individuals and families across multiple North Carolina counties. We are committed to delivering evidence-based treatments with an integrated approach. Through our counseling, medication management, recovery housing, peer support, medication-assisted treatment, accredited provider trainings, inpatient services, pharmacy services, and prevention initiatives, we strive to empower North Carolinians on their journey to recovery. By collaborating with various agencies and securing grant funding, we actively contribute to improving communities in North Carolina. We are dedicated to ensuring high-quality care, fostering partnerships, and embracing innovative strategies to address worsening societal problems, such as low quality of behavioral health care, the opioid crisis, increasing numbers of unsheltered persons, and rising rates of childhood trauma. With our telehealth and in-person services, insurance acceptance, grant-funded programs, and a commitment to confidentiality, we aim to make our services accessible to all. At ICGH, we offer hope and meaningful results, guiding individuals and families towards lasting recovery and promoting overall well-being in our communities. The overarching philosophy at ICGH is to facilitate lifelong recovery through a variety of person-centered interventions, not merely in-office claim-based treatment services. This is achieved through an integrated approach to behavioral health and SUD treatment. ICGH aims to stabilize patients' lives and help them live happily and freely outside of the clinic, following a philosophy of recovery, not treatment. The organization recognizes the importance of intersectoral collaborations to create sustainable change in rural and urban communities. ICGH aims to mitigate the burden placed on rural and urban communities attempting to access care for mental health and addiction treatment services. ICGH centers focus on increasing and improving upon the delivery of services, expanding the peer recovery and community health worker workforce, and creating sustainable access to support and treatment services in rural and urban communities by applying this systems-based approach. Some of the services we provide to adults in North Carolina, that's comprehensive clinical assessment, individual and family counseling, outpatient therapy, EMDR, dual diagnosis groups, gender-specific groups, IOP, comprehensive outpatient, free transportation to ICGH services, recovery housing, transitional as well as permanent housing, Suboxone or medication-assisted treatment, and med management with same-day service, referrals to inpatient treatment facilities, linking to employment and training and educational resources through our supportive employment program, WRAP training, which is Wellness Recovery Action Planning certification, anxiety, depression, anger management, trauma-focused care, and other mental health counseling, DES drug education, free peer support, as well as bridge physical medicine for our clients. When it comes to child and adolescent treatment, we take care of a combination of different diagnoses and everything from obsessive compulsive and obsessional defiant, ADD, ADHD, social anxiety, separation anxiety, even substance use disorder, and PTSD. We do provide trauma-focused CBT, comprehensive clinical assessments. We incorporate prevention screening as well as in-school and community prevention services, school-based therapy, individual and family counseling, mental health services, and our variety, especially trauma-focused CBT. And this is available to children as young as 3 years old who have suffered from complex trauma, including sexual abuse. This is from one of our rostered providers for this service, and absolutely necessary for North Carolina to address the growing problem with children struggling with trauma, especially in our foster care system. Here's some of the criteria for children who can participate in trauma-focused CBT. When it comes to our model of recovery-oriented services, we focus on when it comes to addiction, a 12-step facilitation model that incorporates other evidence-based models such as TFCBT, MET, TA, DBT, and specific interventions to improve the delivery of care, including addressing dual diagnosed persons who also suffer from trauma or other behavioral health problems, whether it's physical medicine, addressing some of the social determinants of health. Those who present for mental health services only are given the most appropriate model of care for their needs from a wide variety of certified providers. That includes EMDR and other interventions. There are a number of things that set us apart, but when it comes to mental health services and behavioral health services, we have very limited group size in our group counseling, flexible counseling schedules, close interaction between an integrated team. This is an interdisciplinary team between doctors and therapists and counselors and pharmacists. We have a number of funded programs for transportation, housing, and medication. So insurance has never been a barrier to getting care from ICGH. We have a variety of mental health clinicians and addiction treatment providers, a variety of medical providers offering MAT and medication management services every day. Our medication assisted treatment and medical supervision, meaning that we have on-call coverage 24 hours a day, co-occurring disorders from substance use disorders as well as mental health. ICGH owns its own retail pharmacy as well as clinic-based pharmacies, and that allows for more confidentiality when picking up medications that often still have a lot of stigma in our society. It allows for better retention in our program. They can get their office visit medication at the same time, or with our mobile medical units, being able to get services out in remote areas in North Carolina and getting the medication at that time. Having our own pharmacist working on our interdisciplinary team really does improve the quality of care as well. We provide a wealth of free services to North Carolinians, from free peer support and provider education training accredited by the AMA and North Carolina Board of Nursing, free treatment for OUD, which is opioid use disorder, as well as alcohol use disorder, depending upon which county, free recovery housing, free transportation for recovery-focused services and treatment services, as well as a lot of other grant-funded opportunities. ICGH is the recipient of several large federal, state, and county-funded grant opportunities. So that means free treatment for those requiring MAT services, free counseling and peer support, outreach supplies to the unsheltered with same-day placement and housing, free transitional housing. We do a lot of anti-stigma TV ads and billboards, as well as funding prevention in the schools. More of the grant funding work that we do, it means lock boxes, rescue Narcan, deterrent bags, peer support specialists inside of emergency departments, shelters, jails, awareness events, big recovery summits, educational opportunities, and a lot more. And generally, we will announce some of these awards on our social media page, and just kind of reviewing the catchment area and the services that we'll be providing. We have provided MAT services, MOUD services for pregnant women prior to a lot of the hospitals ever considering doing this. Some of my very first referrals were from large hospital settings for women who need it. So we have a really specialized program around pregnancy. We expedite induction of our pregnant patients when they seek care. We provide psychoeducation that's compassionate and supportive to prepare the mother for the process of giving birth, even the possible challenge of titration off of Suboxone in the hospital due to medication-assisted treatment during pregnancy. We call it NAS, or neonatal abstinence syndrome. Due to the group-based nature of counseling at our clinic, pregnant women are able to easily forge healthy relationships with other women who are in the program. And we also have a nurse that went through our program while on MAT services, and she works with other pregnant women as they go through that process. Here's an overview of really the integrated approach that we take for all of our treatment planning. I created this slide for Governor Cooper in 2018 when I sat on an opioid panel that he held. And you can see everything that we've talked about today is incorporated here, a biopsychosocial and spiritual model. So there is a medicated, and every disease has these components. So if you're not incorporating the actual interventions and the actual goals, you're not going to get the treatment outcomes that you need. There wasn't a Venn diagram like this or something similar to help guide in treatment planning. So I created this, and it kind of outlines some of the principles and features that are absolutely mandatory in providing this level of care. I will say that when we say spirituality, we're really talking about meaning and purpose. That central component right there. It's about motivation. It's about meaning and purpose. It's not necessarily faith-based, but every one of these components we offer as well, from MOUD, treatment for co-occurring, laboratory and pharmacy services, counseling, and that doesn't mean just drug-free coping skills. That means co-occurring disorders like trauma, as well as a lot of these social interventions. We're providing the transitional housing, supportive employment, transportation, all these other types of services we're providing. We've been doing this work for a very long time, and just very proud of the work that we've been doing with our lawmakers like Patrick McHenry and Tom Tillis, teaching at Wake Forest School of Medicine through Northwest AHEC, large community events and summits, and just really proud of the work we've been doing. Again, strong partners in the faith-based community, our own nonprofit, which began as one of the Project Lazarus organizations, now is Recovery NC, and as well as the research that I've done in North Carolina with the North Carolina Physicians Health Program, primary research with providers with addiction in monitoring. Here's one of our very large recovery summits that we held in Gastonia last year, bringing a lot of amazing speakers from across the country to North Carolina. Our very first recovery housing residence is apartment building in Catawba County under Day One Recovery Homes, providing all of this through grant-funded county funds as well as state funds. Some of our billboards promoted by our RCOR grant, as well as some of the very positive messaging around addiction, trying to fight addiction, stigma, and turning those into some messaging on our outreach bags. Our bags here for the unsheltered are filled up with these supplies, including rescue Narcan, lock boxes, gloves, hats, blankets, etc. And really, it's just an opportunity to connect with somebody who is struggling out there unsheltered or unhoused, and trying to really work with them to provide them some information about services and hopefully bring them into recovery housing. We were featured on Charlotte Today last year around our program for the unsheltered, and this is an image that they created from our program. And there's one of our peer support specialists who himself went through recovery from addiction and experience being unsheltered. He's working directly with people who are unsheltered, connecting with them and bringing them into housing. Keep in mind, our housing isn't a low barrier housing as much as low barrier with treatment. So really treatment focused opportunity to help people turn their life around. That means closing probation cases, DSS cases. While urban unsheltered looks very different, you see the car there that's been abandoned. We have a team that really works well with our law enforcement officers in rural areas to identify different areas where people are unsheltered and connecting with them. We also work very well in rural and urban settings for resource navigation. We have several different grants right now and contracts around resource navigation. I'm very proud of the work we do outside of just mental health treatment and addiction treatment. We've really been able to do a lot of this work through federal grants, like the RCOR Implementation Grant and others, and some state and federal funds have been really essential to providing this kind of resource navigation for people who need help with multiple siloed types of resources. Um, we do this in a couple of our different sites where we have computer labs, connecting people with housing and education, as well as behavioral health services and addiction treatment services. A lot of our harm reduction program, and I think harm reduction has got a really bad rap. Um, I used a lot of harm reduction every day around the seat belt, or my kids use it with helmets when they ride their bicycles. And so a lot of the harm reduction is stuff that's not necessarily like needle exchanges. It's really just lock up your meds, destroy your meds when you're done with them. If you're finished with the prescription, rescue Narcan to save a life so you can get somebody into treatment. And so we do support harm reduction throughout North Carolina. As everyone knows, the overdose crisis continues to rage on, and it's worse than ever. Over 120,000 deaths in 2023. And despite all that we're doing, and so everything that we can do really to address the overdose death rates in our North Carolina counties and get people into treatment services is what we're trying to do. Here are several of our mobile units. We've got a peer recovery bus where one of our peer support specialists will go to a site, whether it'll be an encampment or a shelter, and work with people as a peer support specialist and allow them to understand some of the services around health screenings or Hep C or Hep B treatment, enrollment into recovery housing, or outreach supplies. And then the other unit that we have, they're able to actually get medical services right there on the bus, right there in that RV. Some of our PSA TV ads addressing stigma around addiction. I really like that we've created a lot of these just so that people understand that you can live healthy with diabetes, you can have a very healthy life with hypertension, as well as other kinds of conditions like addiction. I mentioned earlier our provider education programs. These are all AMA accredited, North Carolina Board of Nursing accredited, and really giving the best practices out there to providers who are prescribers or counselors. We host medication assisted 12 steps. You do not have to be in our treatment program. You do not have to be in treatment. But these are fundamental 12-step programs where you can discuss higher power and the steps and have a sponsor. And there's no stigma around medication. If you use medication, a lot of times there might be stigma in your traditional 12-step meetings. So we're very happy to sponsor and promote meetings like this in North Carolina. And because of the popularity of this program, it has gone outside North Carolina. It's mostly virtual. Our nonprofit has done amazing work, and we have really amazing sponsors like United Beverage and others, really identifying gaps in treatment and trying to fund those gaps. Also helping people who are struggling in early recovery, either mental health or addiction, with certain types of things like covering insurance premium or a driver's license or flows for a job interview or helping them with a resume. A lot of different things that we're able to do that really aren't covered by some of the regular services we provide. A little bit about me and my background, as well as our medical director. Very proud of the work that he does for us. Double board certified. And our newest location is out in Sea Level, North Carolina, in Carteret County. Our inpatient facility for facility-based crisis, regional detox, inpatient services, as well as our regular outpatient services. The inpatient services are for adults as well as adolescent. And in Carteret, Craven, and Jones counties, we'll be providing all of the regular outpatient services, recovery housing, resource navigation, and peer support that we do elsewhere in North Carolina. That's really it for today. I want to tell you a little bit of how we focus on a person-centered approach related to recovery rather than just rigid service-focused programs that neglect participation in recovery communities, whether it's from healing from trauma, healing from mental health illness, or addiction. Our counseling, medical, nursing, and administrative staff generally have personal experiences or close contacts with the disease of addiction as well as mental health and are in recovery. As well as this experiential knowledge, they also have clinical knowledge and academic experience. We are equipped to serve the uninsured, insured, privately insured through federal funds, as well as some of the state funds. So, and our diversely trained staff, on-site laboratory, on-site pharmacy enable us to provide a higher quality of care and lower cost of care at all levels of treatment. This is our family of companies. Very proud of the work that we do in this space, including our low barrier North Carolina program called PEOP Online, and my contact information. If you need any information, you can email us directly at contact@integratedcarehickory.com, or you can reach us at our corporate office. Our website has our intakes, online intake forms, as well as our online referral forms, and a lot of information about us. So again, thank you so much for listening today.